moderator for this important discussion on patient safety. Around 16, 17 years ago, when I joined my residency, the patient safety movement was still in its infancy. The WHO World Alliance for Patient Safety was launched a couple of years ago, and there was not much discussion, at least in this country, on patient safety back then. But over the years, the patient safety movement has gathered momentum thanks to WHO, its member states, accreditation bodies like NABH, and many other stakeholders. So now we celebrate the World Patient Safety Day also on every 17th of September, which is just 3 months away from now. And to talk about the global action on patient safety, we are delighted to have with us today Dr. Neelam Dhingra. Dr. Dhingra heads the WHO Transformative Flagship Initiative, a decade of patient safety 2021 to 2030 at WHO headquarters, and provides stewardship to WHO's global efforts in providing strategic leadership on patient safety. Prior to her present role, Dr. Dhingra led the WHO Blood Transfusion Safety Unit for 14 years, from 2000 to 2014. Before joining WHO, she served as a faculty in a tertiary care university hospital in New Delhi for 14 years. She holds an MBBS from LHMC New Delhi and an MD from All India Institute of Medical Sciences New Delhi, and a fellowship from the UK as well. So welcome, Dr. Dhingra. Just give me a moment. I think Dr. Dhingra is calling me. Just give me a moment. Everyone is able to hear me?
Yes, yes.
Okay, probably Dr. Dhingra was not able to hear me. She is joining again. So she had some issue. So let's wait for her to join again. Hi, welcome, ma'am. Can you hear me?
Can you hear me?
Yeah. Now we can hear you loud and clear. So I was just introducing you. So give me opportunity to introduce you again. So yeah.
Thank you.
So welcome, Dr. Dhingra, to this exciting webinar. And as I was telling everyone that we are delighted to have you with us today for this webinar. So, as I was telling, Dr. Dhingra heads the WHO Transformative Flagship Initiative, a decade of patient safety 2021 to 2030 at the WHO headquarters, and provides stewardship to WHO's global efforts in providing strategic leadership on patient safety. Prior to her present role, Dr. Dhingra led the WHO Blood Transfusion Safety Unit for 14 years, from 2000 to 2014. And before joining the WHO, she served as a faculty in Itashi Care University Hospital in New Delhi for 14 years. She holds an MBBS from LHMC New Delhi, an MD from All India Institute of Medical Sciences New Delhi, and a fellowship from UK. So vast experience and great credentials. But before I give the floor to, so we welcome you, ma'am. And before I give floor to you, I would request Dr. Yashpal Sharma, who is the president of AHA, to say a few words and formally welcome our speaker. So over to you, Dr. Sharma.
Thank you so much, Dr. Devnani.
Welcome.
Thank you, Dr. Mahesh. In fact, we're really privileged.
Sir, you are barely audible actually.
Okay, no, can you hear me properly?
Yeah.
Okay. I take this opportunity to first of all, welcome Dr. Neelam Dhingra. You have already introduced her. Ma'am, we are really privileged to have you here in the AHA DG Connect webinar series. And we are lucky to have you today. And you will be speaking on global action on patient safety, which is, a great subject of importance to all of us. Patient safety is a global priority, which highlights that no one should be harmed in the healthcare institutions. And every year, large number of patients are harmed or die because of unsafe healthcare, creating a high burden of death and disability worldwide. All of us know that. On an average, it is estimated that 1 in 10 patients is subject to adverse events while receiving, care in the hospitals. And the most of this patient harm is avoidable. And even the healthcare workers involved in such serious incidents also suffer from lasting psychological harm and deep-seated feeling of guilt and self-criticism. Today, you will be deliberating on global action on the plan on patient safety and will guide us on how to eliminate avoidable harm in healthcare with a vision of a world in which no one is harmed in healthcare, and every patient receives safe and respectable care everywhere, every time. I'm sure that you will also touch the various issues like development of global norms and standards in patient safety, encouragement of research, evidence-based policies, and research in the patient safety. I will not, come in between you and the participants. I will thank once again Dr. Mahesh in getting you here in the webinar of today. And I thank you once again for being here with us. Thank you very much, ma'am.
Thank you, Dr. Yashpal, and thank you, Dr. Devnani. I really, first of all, namaskar to everyone. I'm really grateful for this opportunity. Mahesh and I met actually in Delhi when we were participating in the national workshop on accelerating patient safety action in India. And it has given me such a great opportunity, Mahesh, to connect with, to colleagues in PGI and also across India. I have worked very closely with PGI colleagues in the past as well in my career in blood safety in India. And so it's really homecoming for me. And thank you so much for this opportunity.
Wonderful.
And as already was highlighted by Dr. Yashpal about the importance of patient safety. When we ever go to a health facility, no one ever thinks that we are going to be harmed. When I was a medical student, we thought that whatever harm occurs in a health facility, that's something, a normal consequence of treatment. It has to happen. There was a patient of mine who was, developed jaundice after transfusion. And when I was discussing with my colleagues, and it was like, it was seen as a normal consequence. It was seen that it was unavoidable, as if it had to happen, as if it had to happen. But things have really moved on. And in 1999, the first report came actually globally to Are is Human, Building a Safer Health System, that paved the foundation for a new area of work, a new scientific discipline, which is patient safety. So since then, there have been several studies to assess the burden of harm, but it's very difficult to assess the burden of harm due to unsafe care. Whatever studies we have are mainly from high-income countries. From low-income countries, we have very limited studies. And the best estimates we have is based on 6 indicators only and very limited number of studies, which show that 134 million adverse events happen every year in hospitals in low and middle-income countries alone. So that actually almost means that every 1 minute, 5 patients are dying in hospitals only in the low and middle income countries. Even high income countries have a huge burden of patient harm. So patient safety is truly a global issue. And I would like to show a couple of slides to show the global action on patient safety over the years. And since the time I took over the patient safety program, as you introduced me, I took over patient safety from blood safety program in 2014. And since then, it was very fortunate that several stars were aligned and there was a huge global momentum created on patient safety. And I've been doing my small bit, but there have been political leaders, visionary and strategic leaders who have really provided and paved the way for identifying the unacceptable level of harm which is happening in healthcare. And it really erodes the trust of people. So this is the first principle: first, do no harm. The health system should not do any harm to patients who are coming to seek care. And so this is the entire discipline now, and a huge global movement on this. So if you permit me, I'd like to show a couple of slides. I just want to know how much time you have for me so that we have enough time for question answers as well. Can't hear you.
Unmute yourself.
I can't hear you, Dr. Devnani.
Sir, actually, you are muted, sir.
I'm sorry. I was saying that we have devoted 1 hour for this webinar from 1 p.m. to 2 p.m. Geneva time. So we can keep 10 to 15 minutes in the end for the questions if participants have any. So you can take around half an hour or 35 minutes, as much as you want.
Thank you so much indeed. So just want to make sure that you can see my slide.
Yes, ma'am, we can see. Yeah.
And I'm going to change it, and please let me know if it changes as well.
Yes, it's changing.
Okay, great. So as I show on my first slide, the global roadmap for patient safety. This is a 10-year action plan which was adopted by the World Health Assembly in 2021, and that actually provides the foundation for our global work now. And I'm going to structure this presentation in a couple of major points which I think are important to highlight, which is what is the burden of harm of unsafe care. I mentioned briefly about it, but I just want to share some figures with you. Patient safety is at the heart of UHC. How do we demonstrate that patient safety is really truly at the heart of UHC, and we can never achieve UHC without patient safety? Gap analysis in patient safety, the Global Ministerial Summits on Patient Safety, a WHO resolution on global action on patient safety in May 2019, and then several global patient safety efforts by OECD countries, by G20 group of countries, and G7 group of countries. The Global Patient Safety Action Plan from 2021 to 2030. The WHO Flagship Initiative, which is a decade of patient safety to support the implementation of the action plan. And also a snapshot of the global patient safety movement, the past, the present, and future. So as I mentioned, that the huge burden of harm due to unsafe care. And adverse events are actually likely to be one of the 10 leading causes of death and disability worldwide. Even in high-income countries, 1 in every 10 patients is harmed while receiving hospital care in high-income countries. And as I mentioned, in the low and middle-income countries, the estimates are that 134 million adverse events occur each year in hospitals in the low and middle-income countries alone, and which contribute to about 2.6 million deaths annually, which is a huge, huge burden. And it's not only numbers. If you look at the impact it has, the devastating impact it has on people's lives, and that forever. And some of these events, actually, the errors and the unsafe practices, they don't look that serious, but the consequence and the effect they have is very disproportionate, very, very high level of harm due to even small errors. If you look into primary care, 4 out of 10 patients are harmed in primary and ambulatory care settings. Harm due to different reasons, medication errors, hospital-acquired infections, diagnostic errors. So different type of wrong blood given, wrong dose of radiotherapy given, wrong patient is a very common, wrong patient identification is another very common cause. So several administrative and care processes errors occur in primary care. Huge costs in terms of economy as well of treating these safety failures. And in OECD countries, 15% of the total hospital expenditure actually is the direct results of adverse events. So only in managing the safety failures, you are spending huge amount of resources, which we could have utilized in expanding coverage. And the other important part to note is that most of this harm actually is preventable. So if you put in place in systems and there's full engagement of patients and health workers, and if you implement the key points and key strategies for patient safety, this harm is avoidable. But if you look at also medication safety, 50% of avoidable harm actually in medical care occurs because of medication-related issues. Medication errors or unsafe medication practices, they really are very serious issues to be addressed. And they harm millions of patients and cost billions of dollars every year. So looking into what is the gap, how do we assess the gap in patient safety? The gap in patient safety is, we can qualify from different angles. There's a major knowledge gap as well, because countries do not understand what is the extent of the problem, what actually is causing it and what is contributing to it. So unless we really bridge this gap of knowledge, we understand the extent of the problem, we won't be able to put in place the strategies to address it. A policy gap, there's inadequate policy environment and political will. There are several policies related to different programs, clinical programs and risk areas, or different safety programs as well. Radiation safety will have its own policy and blood safety has its own policy, but they don't talk to each other. So suppose common issues which are at the system level, such a simple thing as patient identification, they are not really cross-fertilizing from one policy to the other, so there's very inadequate policy environment and they don't talk to each other. There's a design gap as well. So we have, several important principles and science implementation tools which can implement the science, but there's inadequate application of science to implementation tools for patient safety. Then looking at delivery gap also, application of management science and practice at organization level and care delivery level is really missing. So there's a big gap in application of these sciences. And communication gap relates to, one part of the hospital, we have very good practices, but the other area in the hospital may not really be aware of it. So there's a big communication gap within countries, within cities, within hospitals, within healthcare systems and organizations itself. So we are not able to collate and disseminate best practices, innovations and coping mechanisms, learning from different experiences. So these are major gaps which really need to be addressed to improve patient safety. There has been an unprecedented global momentum on patient safety in the last couple of years. When I was joining patient safety in 2014, 2015, that was a time when political leaders, particularly from the UK and Germany, recognized as a huge burden of harm, litigations and serious cost implications. So something really needs to be done at a very high level for patient safety. So there was a huge political drive to work on patient safety. And the leadership of UK and Germany together started global ministerial summits on patient safety from 2016. So the first summit in this series was organized by the UK government, and it was held in London in 2016. And I was very fortunate to be involved from the very beginning in this movement. So I attended all the summits, and there's a steering committee also for planning for future ministerial summits in which WHO has a co-chair role. So we are working with countries to ensure that this momentum, which we have generated after so many ministerial summits and involvement of governments around the world, is sustained and leads to actually impact and improvements at country level. So moving from London in 2016, and then Germany in 2017, in Tokyo in 2018, and you can see all health ministers and very high officials participating in the summit. 2019, it was in Saudi Arabia, and in this year, February 2023, Swiss government hosted the summit in Montreux. And WHO leadership has been from the very beginning fully involved in these initiatives at strategic level and truly collaborative with these government political leaders who've been driving this together with WHO. And this momentum which was created over the years, particularly these initial 4 summits, and they were, of course, you can see there was a gap from 2019 because of COVID. The summits series was put on hold. And this momentum which was created from 2016 to 2019 led to a landmark moment and watershed moment for patient safety at the World Health Assembly. The World Health Assembly, I'm sure you're all aware, it meets every year in May and brings together all the ministers of health and high-level policymakers and delegations for all member states of WHO, 194 countries and 3 associate members. So all member states of WHO, they meet as a part of the governing body, which is the World Health Assembly, and they decide on resolutions and take several decisions. So in 2019 May, building onto this momentum of the ministerial summit, several countries proposed an agenda item and then adopted a resolution on global action on patient safety, which is a very comprehensive resolution. It's available on the website, and you can see it has 13 action points for member states and also 13 action points for WHO to implement this resolution. And this particular assembly also recognized patient safety as a global health priority, considering the huge burden of avoidable harm in healthcare globally. And also it's established an annual World Patient Safety Day to be observed on 17th September every year for having global engagement and enhancing the understanding of patient safety issues. And the World Health Assembly also asked WHO to formulate a global patient safety action plan, which is aligned with the Sustainable Development Goals and gives a roadmap for 10 years from 2021 to 2030. So this was a really watershed landmark moment. While these efforts were developing, there were several other organizations who were leading initiatives, such as OECD developed a series of economics of patient safety to build a case to prioritize patient safety. From 2017 onwards, every year there's been a report on economics of patient safety. And some of these themes have also been aligned with these themes of World Patient Safety Day. You can see the first one was economics of patient safety, mainly at hospital level. The second was in 2018 was at the primary and ambulatory care level, flying blind. And then how do you actually, what is the economics of patient safety and how do you take analysis to action? In 2020, there was a report on long-term care and also on health worker safety. Last year, there was a report on medication safety. This year, they are working on a report on patient engagement. So economics of patient safety, and through different strategies and actions which need to be taken, and demonstrating that there's significant savings when you invest in patient safety. And this is the evidence which has been generated from this OECD series. Similarly, after the Jeddah summit in 2019, Saudi Arabia was hosting the presidency of G20. That was in 2020. And they had actually, building on to the success of the Jeddah summit and also Jeddah Declaration on Patient Safety, which was adopted at the summit, there was an agenda proposed for patient safety. And you can see on your screen the health declaration of G20 health ministers, which identified patient safety as one of the key action areas and established a global leaders patient safety group to work with the G20 countries and provide leadership on patient safety. In 2021, Italy was hosting the presidency, and again, this was a legacy item which was taken forward. In 2022 and 23, going forward, Indonesia, India, patient safety is embedded in most of these actions for health declarations which are being discussed by the health minister. So being a very integral and cross-cutting area of work of first do no harm, it's really taken forward through subsequent G20 presidency leaderships as well. Also in 2020, there was another report which was published by the G20 Health Development Partnership, which was the Overlooked Pandemic. And Dr. Tedros, WHO DG, contributed to this publication as well. The Overlooked Pandemic, How to Transform Patient Safety and Save Healthcare Systems. So this was again a very important landmark to highlight to the global leaders that while we are addressing COVID pandemic, we also have to look into the actual harm which is happening in healthcare every day, which was even further exacerbated during the COVID pandemic time. The G7 leadership of the UK government in 2021, also there was an important event organized in collaboration and co-sponsored by WHO on patient safety from vision to reality. And this was a high-level event which was really brought against advocacy and also facilitated international collaboration for taking action on patient safety. So as I mentioned that when these events were developing, WHO also as a response to the global call for action, WHO also launched a decade of patient safety. And there are several streams of work in our program, and some of these are just shown here on your screen. So of course, the most important is giving a visibility to patient safety through global advocacy, engagement of public and community, increasing and enhancing the awareness of one and all on what are patient safety issues. When you go to healthcare system, you know, how you can actually have to keep yourself safe, what is unsafe care, and what is your role as a community, as a patient, as a family member to keep safe, and also contribute not only for your own care, but also contribute broadly to the safety of the healthcare services and the system. So World Patient Safety Day, every year there's a theme identified, as you're aware. The second stream of work is actually taking forward the Global Patient Safety Action Plan, which was adopted by the World Health Assembly in 2021. And I'll go into detail of that later on. And then we have an ongoing challenge on medication without harm as well, which I'll delve into later on as well, which is to address unsafe medication practices and medication errors. The Global Patient Safety Collaborative and an initiative to work with developing countries and also a Global Patient Safety Network, which most of you are members of. And if you're not, we invite you to become members. This is a interactive network to discuss issues of patient safety and also bring forward solutions and share resources on patient safety. WHO also works on developing several standards and guidelines and tools. We have several important guidelines. This one I show you here is reporting and learning guidance. How do you establish reporting and learning systems? And how do you improve learning from errors and harm? How do you improve the system, the practices, the policy and the practices and day-to-day care? And finally, patient-family engagement is a very, very important role patients and families have in the safety of their own as well as of the health system. So there's a full stream of work on patient and family engagement as well. So I just want to share with you the actual journey of the Global Patient Safety Action Plan development, which was after the resolution was adopted. It took us 2 years to develop the action plan through several internal and expert consultations, public consultation, member state consultation, submission to the World Health Assembly, and final adoption in 2021, which was then launched by Dr. Tedros, WHO Director General, on the 4th of August 2021. And this action plan, which is now the foundation of our work, is a roadmap for patient safety. And the Assembly adopted this resolution in 2021 on 31st of May, and also asked WHO to report back on the progress every 2 years. So just last month in May, we submitted the first report on the implementation of the action plan. And we would be submitting another 4 reports as well. So every biennium for four next biennials, we will be reporting on the progress. And we really are working towards it. And we are we have strong belief and also very hopeful that countries and partners will play their role in implementation, and we will be able to show progress over a period of these 10 years. Just wanted to show you this concept which we have put in place when we are working as a patient safety flagship, a decade of patient safety, that we work across health systems components and also specific safety, health and clinical programs. So several programs, as you're aware, safety-related programs on immunization safety, medication safety, blood safety, radiation safety, injection safety, IPC, medication safety, device safety. All these safety programs many times work in isolation, but they are the subject matter. They have the subject matter knowledge. And similarly, there are several health programs like safe childbirth, surgery, safety in mental health, safety in elderly care, safety in non-communicable and communicable diseases, patient falls. So different clinical and health programs have a component of safety. And what we are now bringing from the health system perspective is a profound system understanding that, why it is important to have leadership and policy frameworks, reporting and learning systems, patient safety education and training, human factor application as we apply in aviation industry, organizational safety culture and transparency, and patient family engagement, campaigns and advocacy and assessments and measurement. So this is the patient safety core work. And now we are working together very closely with the clinical and safety programs so that all the principles and strategies of patient safety could be implemented through the programmatic activities which are at the point of care. So bringing the system and the front line together so that the practices and policies of patient safety are then implemented through these clinical and safety programs. The action plan I just want to share with you, it is a very well-structured action plan, which is based on a 7x5 matrix, and it has 7 strategic objectives, and each strategic objective has 5 strategies. And we also have provided 10 core indicators to governments to report every year. So the first survey we did this year, we got reports from 102 countries, and we submitted the interim report as well to the World Health Assembly in May. And in November, we are going to launch a full-fledged Global Patient Safety Report 2023, which will be based on the survey as well as build onto some country stories and best practices, and also look into the overview of the burden of harm which happens due to unsafe care. So going a bit deeper into these strategic objectives and what actually do they mean. And as I mentioned already, the 7x5 matrix is here. The other important thing which the action plan elaborates is who are the partners in action, who has to take action. So sometimes we say it's government, sometimes we say it's WHO, but actually until unless each and every partner takes an action related to this action plan, we cannot achieve zero harm, which is the vision of this action plan. So governments and government agencies are major partners in action. Then all stakeholders, which includes the civil society organizations, patient organizations, professional bodies, academic institutions, research institutions, those who have involvement and developmental partners, they are major stakeholders in this. Their action is extremely vital as well. Then action at healthcare facilities and services by the healthcare administrators, the audience of this, the participants of this webinar, and also the healthcare leaders. What action is required at the facility level by the healthcare leaders and administrators, and also by health workers who are at the front line, who are actually providing care, the doctor, physicians, the nurses and pharmacists, and all those who are at the front end, what actions are required by them. And the WHO Secretariat through 3 levels of the organization, the global level, the regional level, and the country level as well. I'm sure you're aware that out of 194 member states of WHO, there are about 150 countries have WHO country offices as well, which work very closely with the ministries of health and work on ground based on the country context and country priorities. What we are asking countries to do, at least the 10 action points which we have given to countries to implement the action plan, just listed in these 2 slides. Firstly, we are asking countries that align your the action plan to your national requirements. So develop a national patient safety action plan, which is based on the global patient safety action plan. Establish a patient safety incident reporting and learning systems or adverse event reporting system so that we can learn from what has gone wrong in the system and how we avoid that, how we put in place changes and how we improve the system and the policies and the practices. Implement the ongoing global patient safety challenge on medication without harm, which is a very extremely top priority issue for us, because 50% of avoidable harm in healthcare actually occurs due to medication errors and unsafe practices. This extremely important area of work to work on medication safety, and this is an initiative we have, a multi-year initiative on medication without harm, in which we are developing several tools and guidelines and strategies to work with countries to support and work with them to implement the program on medication safety. Celebrate World Patient Safety Day to maximize its impact based on the thematic area and operationalize the National Patient Safety Network, which brings together all the stakeholders at national level and find challenges and find solutions together so that we can interact in real time. And this could be also aligned with the Global Patient Safety Network, which is an extremely interactive network, have 155 countries represented and more than 2,800 active members. Then coming to education training, incorporate patient safety curriculum in medical and nursing professional education, report progress on patient safety through the member state survey, which we are organizing every 2 years. The one which we were doing last year concluded this year. So the next round of survey will be started next year in 24, and we'll be reporting in 25 to the World Health Assembly, and also work on a global patient safety report, which is a very comprehensive report we are working on. The first report we're working on is for this year, and every 2 years we plan to develop that report also. So we're asking countries to report progress on patient safety through the surveys. Institute a policy of having a patient representative in all hospital governing boards. This is one of the core indicators as well for the action plan, that in any country we are recommending that more than 60% of hospitals, the majority of hospitals and health facilities should have, those who have a governing board, should have a patient representative and bring the voice of patients. And that's extremely vital to elevate the voice of patient, which is also the theme for World Patient Safety Day this year. So I'll speak about it a bit later on the World Patient Safety Day theme. Then prioritize and provide resources to patient safety programs at national, subnational, local levels, and strategize patient safety as a force multiplier for health services improvement programs. So whichever clinical program or health system programs are running, how we can integrate patient safety, considering it is a foundational principle of healthcare provision. First, do no harm. How do we strategize patient safety as a force multiplier? So these are the 10 key action points which we're asking countries to undertake to take forward action on the action plan. So now going to a little bit on the details of the report, as well as some details on the action plan, what are the strategies under each of the strategic objectives, and how countries have reported in the first survey, and the interim report, as I said, which was then submitted to the World Health Assembly last month. So the first strategic objective is policy to eliminate avoidable harm in healthcare. So primarily it is asking countries that when you are developing policies, keep in mind that it should be a zero harm policy, so that you can ultimately achieve zero harm, because even one case of harm in healthcare which was avoidable is too many. So work towards zero harm. And this particular strategic objective relates to development of policies, provision of resources, legislation, safety standards, and special initiatives of WHO like the Global Patient Safety Challenge and the campaigns on World Patient Safety Day. So the initial results show on this core indicator that how many countries have developed a National Patient Safety Action Plan or equivalent. From the 102 countries who reported, only 27% countries have really developed this. So we are a long way to go to achieve this, the target of having all countries having a National Patient Safety Action Plan and taking it forward. So this is what the first survey has shown us after 2 years of the action plan, when the action plan was launched. So what we are doing is we are working with countries, providing policy dialogue and technical support for implementing and monitoring of the action plan, giving them support and working with them to develop national policies, strategies and plans for implementation and monitoring. And for the Global Patient Safety Challenge, which is a global priority setting and improvement program, there have been 2 previous challenges of clean care is safe care and safe surgery saves life, and the ongoing challenge on medication without harm. So we're working with countries to take forward all the challenges, but currently also focus on medication without harm. And through World Patient Safety Day, focus on annual thematic area requiring urgent attention and action. In February last year, we had a policy makers forum for patient safety implementation. This was a virtual meeting, and we had 90 countries who participated and more than 320 participants. who came together and developed a consensus statement, which is available on WHO website. You can just search it as well on the net, and on role of policymakers and healthcare leaders in implementing the action plan. We've seen now several countries moving ahead on developing policies, and that shows the impact at national level. So you can see Sri Lanka has a national strategic plan on healthcare quality and safety. England has the NHS patient safety strategy. Nepal has a patient safety action plan. Ireland has developed a patient safety strategy as well. Finland, Malaysia, India, Kenya developed last year a national policy as well as a national action plan. And India, of course, had an ongoing initiative on patient safety. And when we met in February, it was basically taking forward this action forward. So there is a national patient safety implementation plan already in India, which is now in the phases of implementation, and it's truly aligned with the Global Patient Safety Action Plan. Just a few words about the World Patient Safety Day. We've observed 4 very successful World Patient Safety Days, and we are now in the 5th year. The very first one in 2019, we established a legacy of it. We created a visual identity for World Patient Safety. They also created a visual identity for patient safety. It's globally recognized now, and also asked countries to lit up monuments and iconic places in orange color, which is again taking year after year. It's increasing. More and more countries, entire cities are being lit up on 17th September. This is a famous jet of water in Geneva Lake, and every year on 17th September for the last 4 years, it's lit up. And for 2023 also, we have the commitment of Geneva authorities that they will light it up on 17th September. So it's a mark of global solidarity. And the very first World Patient Safety Day was, the slogan was "Speak Up for Patient Safety." So we've been building on to this, the thematic areas. The second World Patient Safety Day was on health worker safety, which was during the COVID time, and identifying the issues that health workers were facing. And again, full campaign and several materials were developed related to that. And all of them are available on WHO website, and also there are dedicated websites for World Patient Safety Day for each of these years. So you can go into the campaign website for WHO, and you will find all the key messages and materials which were developed for respective years. 2021 was Save Maternal and Newborn Care, with the slogan, Act Now for Safe and Respectful Childbirth. And last year was aligning with the Global Patient Safety Challenge on Medication Without Harm, focus action through World Patient Safety Day platform on medication without harm. Again, we had monthly webinar series last year on medication safety, and several products which were developed and also are being developed currently on medication safety. Globally, every year we have thousands of pictures coming from around the world, lighting up monuments in orange on the 17th September. Sometimes a full week they're lighting up. It's really taking forward this movement and global solidarity of lighting up in orange. As I mentioned, this year the theme is on engaging patients for patient safety. We are actually organizing for the first time a global conference as well. Most of these events at the World Patient Safety Day in the past, considering they were all in the COVID time, happened virtual. This is the first one we are planning in person in Geneva on the 12th and 13th. And to commemorate the day, also build awareness on patient engagement, provide a platform for key stakeholders, and co-develop a patient safety rights charter. So this will be open for about 150 participants in person, and open to the global audience online. So in case you are interested, please let us know, for in-person or for online participation. We'll be opening a registration as well for this event. We are also in the process of collecting patient stories and experience in healthcare, so that we can build on to the experience of patients and what are their sort of directions and suggestions and for improvement for the safety of healthcare. So coming to the second one, which is high reliability systems, this deals with safety culture, leadership, governance, human factors, and patient safety in emergencies as well. And we have one core indicator on this, which is how many countries have a system of reporting never events or sentinel events. And as of now, 36% countries have this system of reporting adverse never events. So in this area, we are working on a leadership competency framework and going to build capacity of leaders in patient safety, technical guidance on organization safety culture, also practical guidance on applying human factors for patient safety and health worker safety, and a series of publications on patient safety in emergencies, particularly related to COVID. So this was a rapid review which we published on implications of the pandemic for patient safety. It was published last year, again available on the web. And we are also now working on a policy brief and practical guidance on how to ensure patient safety during the time of pandemics and disaster and emergency situations. Number 3 relates to safety of clinical processes, which is identifying risk-prone procedures, looking into the safety of the use of devices, medicines, blood and drug products, vaccines, special programs, particularly in medication safety and infection prevention control, safety of primary care, ensuring safety during transitions of care, and also mental health settings. And just on medication safety, as I mentioned, it was launched actually it was launched at the second Ministerial Summit in 2017, and several range of materials have been developed on it. And this is my request to all members who are attending to take forward this campaign on no check asks in your respective hospitals. This is about messages for health workers and for patients. So patients, before you take it, no check ask, and health workers, before you give it, no check ask. And these are banners available, very clear messages. We've developed a 5 moments of medication safety as well. It's a very important tool for engaging patients and health workers at the time of starting, taking, adding, reviewing, and stopping. So the mnemonic stars in English. And so another request to everyone to take forward these tools and implement in your day-to-day practice. We also have a application, WHO MedSafe, which is based on the 5 moments of medication safety. We develop a strategic framework. How do you actually ensure medication safety, actions for patients, for healthcare workers, on medicines as well, and also systems and practice of medication. Several reports have been developed on key priority areas, which is high-risk situations, patient safety, medication safety in transitions of care, and medication safety in polypharmacy. So a huge amount of materials and guidance has been developed on medication safety and still being developed. You can see we are now going to launch very soon medication safety for look-alike, sound-alike medicines. And we also have already publications on medication errors as part of a technical series on safer primary care. Several other tools we developed on surgical safety checklist, which is going to be revised as well. So in this area, you see there are 2 indicators which we have given in this strategic objectives. 18% countries, only 18% countries have established their national targets for reducing medication harm. So again, a long way to go. And 31% countries have established their targets for reducing healthcare-associated infection rates. So these are the campaigns which are going for several years, but even for IPC, also a long way to go to reduce healthcare-associated infections. Going to focus on several areas: medication safety, diagnostic safety, surgical, safe childbirth, primary care, working on several patient safety solutions as interventions at point of care, and also going to work on scaling up of medication without harm challenge, and also working with several programs, IPC and clinical services, to implement patient safety strategies. So I'll just quickly move ahead with the rest. Patient family engagement relates to information, education, learning, co-development with patients, having patient advocates and champions, and particularly on incident disclosure. And in this area also, we have given several tools. There is a indicator also, and again shows a major gap here. Only 13% countries have patient representatives on governing boards or equivalent in the mechanisms in 60% more hospitals. So long way to go. And we are expanding a patient for patient safety network, which is bringing together patients and families who have been harmed in healthcare, working on action framework on patient engagement, a rights charter, storytelling toolkit, a compendium of stories, patient engagement tools, capacity building. So lots and lots of activities are being planned at the global level to build capacity and have enhanced the engagement of patients and families. On health worker education, skills and safety, establishing centers of excellence, education and training, patient safety as competencies as part of the appraisal system, and safe working environment. And again, in this, we have two indicators also for this SO on health worker education skills and safety, which is about curriculum implementation. How many, so 20% countries have only incorporated patient safety curriculum in education programs. And the best, I think, which I've seen is that the nursing professionals have utilized patient safety curriculum in the best possible way so far. And 66% countries have incorporated patient safety in the nursing education programs, but long way to go for other programs. We have a patient safety curriculum guide, as you are aware, hopefully. These are also available, and we are now developing an interprofessional edition also of patient safety curriculum guides, which gives different topics to be included in curricula when you're developing the curricula for different courses. How do you embed patient safety in those education programs? We have a health worker safety charter, which was launched in 2022, and only 18% countries actually have signed up to this charter. So long way to go also for the charter as well. Coming to the sixth strategic objective of information research and risk management, about reporting and learning systems, surveillance, research, and digital technology. Again, several guidelines have been developed, but implementation is not really up to mark. So this is where we have to now invest. Only 31% countries have 60% or more healthcare facilities which participate in reporting and learning systems. So a huge emphasis on reporting and learning systems. And also, we actually, one of the indicator for sharing of this, knowledge and assessment of patient safety at national level, we asked for countries to publish annual reports on patient safety. So only 18% countries actually publish a report on patient safety. So this is again a long way to go in this area. Synergy, partnership, solidarity, lots and lots of action happening here, common understanding, stakeholder engagement, networks, multi-sectoral initiatives, and our linguistic technical programs. So in WHO, we have several important networks: the Global Patient Safety Network, the Patient for Patient Safety Network, and only yesterday we launched the Asia Pacific Patient Safety Network as well, the Singapore Center of Institute for Patient Safety and Quality. And we recommend countries to have national networks as well, which are created under the umbrella of WHO also. And as of now, only 22% of countries have established a national patient safety network. So long way to go. We have several collaborative models, Global Patient Safety Collaborative, working with Imperial College London and providing support to several countries. India is one of the countries in this collaborative as an ongoing initiative, working very closely with the Ministry of Health and the country office in India and the regional office also in New Delhi. Several WHO collaborating centers, and this is again a call for institutes in India who are interested in working on patient safety to take this discussion forward so that we can look into centers of excellence and establish them as collaborating centers of WHO if you are willing to take forward activities on behalf of WHO for patient safety. Several non-state actors, almost all professional bodies at the global level, we work very, very closely with pharmacists or patient organizations or midwives, nurses, hospital federations, and clinical pharmacologists, anesthesia societies, medical associations, WONCA. And we're also establishing a knowledge sharing platform, which will provide a one-stop for every resource to be available on patient safety. So a huge amount of activities going on in terms of knowledge sharing and collaboration. And steering committees, we also are participating in Ministerial Summit Steering Committee, World Patient Safety Day Steering Committees, and the Global Patient Safety Leaders Group of G20. So I think I just would like to conclude with the next one or two slides, inviting members to join the Global Patient Safety Network. And I just want to share that working on World Patient Safety Day has provided us huge opportunities to work cross programs. And again, you can take that forward even at national, subnational, and local level. So this is my last slide to show a journey from past, present, and future. Foundation was laid in 1999 with a report to Arins Human. And the first and the second challenge was launched at this time. There was a resolution on patient safety in 2002 as well, which led to some improvements in some countries, but it was not sustained. And then there was a quiet period, but the rejuvenation happened with the Ministerial Summit series. which the first and the second summit series, and the launch of the WHO Medication Without Harm Challenge, the third summit, the network, and then the watershed moment in 2019, as I mentioned, with the resolution and the World Patient Safety Day, and a future vision of the action plan and the decade of patient safety. So with that, I would like to thank you and really, really look forward to working with you. The common vision, which was shared earlier, a world in which no one is harmed in healthcare and every patient receives safe and respectful care every time, everywhere. So thank you so much, Dr. Devnani, and really appreciate this opportunity. And I hope that we have some time for questions as well.
Yeah, thank you very much, Dr. Dhingra, for such a comprehensive and insightful overview on the global action on patient safety. And I'm sure this discussion will motivate many of our members to revisit patient safety standards in their respective establishments and improve them, address them, and will also motivate them to better prepare and celebrate this year's World Patient Safety Day, which is on the 17th of September. So thank you very much. This was really informative and really helpful. So we have a few hands raised. How much time, ma'am, you have? I can, 2-3 questions you can take.
I'm fine. I'm fine. I have my next appointment at 2:30, so I'm fine actually. Thank you.
Okay. So I see a few hands. The first one is Farida Wani. Please go ahead, Farida, and ask your question. Farida, can you hear me? If not, then we can move to the next person, which is Parveen Kumari. Parveen ji, you can go ahead and ask your question. No. Anthony has saying something. Okay, if anyone has a question, can raise the hand. As I have a few questions. So I have a question, ma'am, that you talked about this profound system understanding and a little shift from the clinical focus on the clinical aspects. Can you say a little bit more on what is your experience till now on this profound system understanding, and how are you taking it forward?
So, health system is a very complex interaction between different components. And that, of course, is policies, leadership, governance, health workforce, information management, participation of communities. These are common threads, they are also called as core components or building blocks of health systems. And many times when we are truly at the front line, we are not looking at the big picture, that something which is very systemic, which will have impact at front line. So we are looking into how leadership at organization level can be strengthened, so that there is a transparency, there's safety, a safe culture, and people are free to speak about unsafe care. They can report on events, and there is in general, environment of safety and not hiding mistakes. So I think this is the biggest challenge which I've seen in health, health services, is implementing a safety culture, which is a very important component of safety system. How do you actually make sure there's transparency and we are not, afraid of our mistakes? Because most of the mistakes which happen, the errors which happen, the unsafe practices which happen, are not because of individuals. No one comes to work every day to harm somebody or to make errors. We all come with a goodwill, but there is an element of human factors or human fallibility. And how do we design a system that the risk of error because of human factors is reduced? Whenever we interact with our team members, whenever we interact with machines, with the new technology introduction and AI, it's going to be hugely important. How do we apply human factors and basically put in strategies which are looking into those risk-prone areas, the error-prone areas, and address it systematically. And I'm sure you know this very famous example of ATM machines. In the beginning, ATM machines, the way they were structured, you had to actually used to get your money and get your card in the end. And many people used to just leave their card and take the money and go away. But then it was realized that it's a design issue. So now when you put in your card and you say how much money you need, you actually have to get your card back first and then you get your money. So you will not lose your card. There's a forcing function in a way. So similarly, we have to put forcing functions, particularly on high-risk medications, for example. How the high-risk medications are stored in a health facility, and what strategies we have put in place to ensure that these are not easily accessible. So there's some sort of forcing function, but they should be accessible when required. So I would say broadly, there are several elements of the health system: the health workforce, information, data, risk assessment as well. How do risk assessment and management, and the whole aspect of leadership and governance. How do you put in mechanisms and systems in place? And then there's a very important interaction of these different elements. As you mentioned yourself, extremely important to have both health workers, those who are on the front end, and patients both taking initiative for engagement. And particularly in countries such as India or many other developing countries where human resources are always scarce, we will never have enough health workers to cater to the needs of patients. So patients will have to be educated, informed, and they have to be empowered so that they can take their own responsibility for their safety and healthcare. Their full involvement has to be there. There's no other way. That's a very powerful resource which we are really not utilizing. And I think it's really hugely important to engage our patients and families so that they take responsibility for their own care, and they also contribute to the safety of health system in their respective roles. And that is the indicator I mentioned, have a patient representative on governing boards of hospitals and health facilities come from there. So the patients and families have a major role for the health system as well. It's not the health system is only providing care, but also receiving input from them for improvement.
Yeah, wonderful. Many Rogi Kalyan Samitis in the hospitals do have their representatives of the community. So I don't know if I think that would be counted as the patient representatives or not. The Rogi Kalyan.
Yeah, absolutely. There will be. Yeah.
Okay. So I think there is a question someone wants to ask. Is that Dr. Basant Kumar Gupta wants to ask something? Dr. Basant? Please unmute yourself. No? Okay, I just wanted to let you know one more thing. You mentioned about the signages for the medication safety. The last year, when this was the theme of the World Patient Safety Day, we in fact displayed these. We have displayed these signages in different parts of at least our hospital, in the pharmacy, in the clinical areas, in the OPDs. Where before you take in the patient care areas for patients before they take the medications, and in the pharmacy before they dispense the medicine. So they are really helpful. So thank you very much. And thank you very much for all that you do for the patient safety and improve the patient safety in this world. To you, to WHO, to your team. And thank you very much for taking out time today to discuss all this with us, to apprise us about these things. And we hope to strengthen our relationship of the Academy with the WHO in future. So thank you very much. And I thank all the participants also for attending today. I thank all my colleagues in the Board of Executives in AHA and the wonderful team of AHA which works in the background to make these webinars successful. So until we meet again in the future webinar in a couple of weeks, I wish you all the best and please take good care of you. Thank you very much.
Thank you so much, Dr. Devnani, and it's such a unique opportunity for me to connect with my country people, and I just feel coming home. It is such a pleasure, and as the time was of course always limited, there are so many aspects of patient safety, and I in a way touched upon some of them, but maybe in future we can deep dive into, say, reporting and learning system, for example, or entire area of patient engagement. How do we enhance, like we were discussing yesterday at the launch of the apps network as well in Singapore. So there are several strategies which can we can deep dive into, look into what needs to be done. And I think there are several opportunities of collaboration as well with experts like yourself and in the group, the healthcare leaders, administrators. They have an extremely important role to play in patient safety. So, you know, even simple procedures like a system for patient identification, for example, streamlining the clinical processes. So, and we can, please let us know also what type of tools and guidelines and simple, you know, devices or simple, I would say, guidance which you require for day-to-day practices to improve safety so that we can work on those with our partners as well. So we really depend on your guidance. What should we be doing so that our programs are successful?
Yeah, that sounds wonderful, and we'd love to continue this association and collaboration for to improve the patient safety in this country, because that is not much has been talked about, and done. A lot needs to be done also. So, thank you very much for your words and support.
Thank you, and pleasure is mine. Thank you very much. Namaskar. Bye.
Thank you. Namaskar.
Thank you.
Thank you.
Thank you.